She would sometimes go without so that I could have some because I couldn't get access.
We do not have any health insurance, and it's a big deal. And our life is like health insurance every day.
It's the fastest option right now that we have to get this GAP population funneled into Medicaid.
People's lives are at stake and people's well-being is at stake.
We're stuck right now because of the system. That's how it's set up for us. It's very scary. It is very scary.
I probably wouldn't be alive if it weren't for her today. At one point I was showering and I noticed something really different, and I was freaked out because I didn't know what's happening, because I thought maybe my guts were falling out, something was falling out. So I went to the doctor and he examined me and told me, not only is your uterus falling out, your bladder's falling out too. So I told him, what do I do? What do I do? Well, he told me just to push it back in, and it's very uncomfortable. It's very uncomfortable. Our insides aren't supposed to be our outsides. Let me put it that way.
He told you to push it back in?
Yeah. He told me to.
Didn't even help you?
Mm-mm.
Leslie is one of the consumers in the coverage gap that has a long history with being uninsured.
For the people who are well off, we have excellent medical care. I mean, we have some of the most innovative, forward-thinking practices, but that's only available to those who actually have insurance and have the money to pay for that. And so there's a big gap of people who are uninsured and who are unable to access the system at all.
She, from the time when she was in her early 20s, would start working, lose coverage, get sick, get on Medicaid, get healthy, start working again, lose coverage. So she's gone through lots of up and downs with the system, and it's kind of made her a little bit jaded about paying into a system that's not taking care of her. Proposition 3 is the Medicaid expansion ballot initiative that we've been working on.
Medicaid expansion is something that will provide Medicaid to people who need insurance but can't afford insurance or can't get insurance through their job.
So there's about 150,000 Utahns right now that are in the coverage gap that don't have access to any type of health care, and we want to invest in those people, give them health care, give them access, and then get them into the workforce.
Here I am with the disease and I can't get any prescriptions that they would cover, and I was at a dead end. It was depressing, it was sad.
She's on what's called Primary Care Network, which is just a basic insurance. You can get 4 prescriptions a month, which doesn't begin to cover the amount of care that she needs.
At one point I had a stroke and the doctor told me, you're having a stroke, go home. One of the PCN doctors.
People who have chronic pain and who aren't able to well manage that pain, a lot of times they get started on opiate medications. And one thing that I'd love to offer to my patients who have pain is physical therapy, or potentially procedures or injections, or mental health therapy, which can be a big part of chronic pain. But all of those things require insurance.
To see that how Americans are struggling with healthcare, with the healthcare system in America, is interesting. Talking about Canada, think about Europe, their system is good. So for us, we stuck on politics of talking about healthcare. We forgot that healthcare is the best things you can ever do for your own people.
Leonard came to the United States. He was resettled from the Democratic Republic of the Congo, I believe 16 years ago. Now he works as a healthcare navigator. He falls right into that gap of doesn't qualify for Medicaid, but also can't get an attractive subsidy on the marketplace, so he doesn't have access to affordable health care.
When I came here, I got refugee Medicaid, which lasted for 8 months. And after that, I stayed without insurance.
His wife just delivered a baby, and so she had emergency Medicaid while she was pregnant and for the delivery, but now that she has given birth, she's now in the coverage gap with him. So talking with Leonard, watching him with his children, he's worried because he knows anything can happen at any time.
I'm stuck. I'm thinking always about healthcare because anytime I go in the car, I think about that. Anytime I wake up, I think about my children. Anytime my wife goes in the car, we think about what happens if something happens here because we do not have any health insurance. And it's a big deal. And our life is like health insurance every day.
Without having any insurance, my health has deteriorated a lot faster than it would normally. I've always wanted to work. I've always looked for jobs. I worked a part-time job because I knew that's all I could really handle.
The problem is that if someone has chronic medical conditions, they're not going to be able to go out and find work because they're sick.
Some people think that this type of policy will deter people from working, but we're actually seeing that the way that Medicaid is existing right now is deterring people from working because as soon as they get access to a very low-skilled, low-paying part-time job, they immediately get cut off of health care. So we're trying to expand this policy so that people can start working, still have coverage, and be funneled into a healthier situation.
My sister had passed away, and she had COPD like me, and a lot of times she would like give me her inhalers or get some from her doctor and would give me the samples in order to get me through with my COPD condition. And she would sometimes go without so that I could have some because I couldn't get access. Because I'd go to their doctors and they just sent me home with nothing. On the day of her funeral, I cut all my hair off. And dyed it pink and it gave me some kind of empowerment. I don't know why, but it was probably for her. I probably wouldn't be alive if it weren't for her today.
Most physicians and providers really support Medicaid expansion. At a community health center where we see underserved patients and uninsured patients every day, we see the ways that that really has a negative effect on their health. Hospitals and emergency departments as well have people who come in there when things get really bad, and they can see that those patients would have done better if they had earlier care in a primary care setting. And ultimately the hospitals suffer too because they are paying a lot more money to care for these people for a much more complicated problem that could have been taken care of earlier.
This is going to expand Medicaid to the 133% federal poverty level. That's about, for an individual, that's about $17,000 a year, or a family of four, that's about $33,000 a year. So this is, low income, really low income people.
Right now, it's much more expensive to go to the emergency room or to go to the hospital when your problem is at its worst. And that costs, I think, the healthcare industry, and it costs our community in the long run much more money to do it that way rather than to have people seeking out preventive care to begin with.
Other states have shown that if you expand Medicaid, then the premiums existing for higher income people on the ACA, the marketplace, their premiums are going to decrease because we're reallocating risk pools in the ACA to Medicaid. Another thing that's going to happen if we expand Medicaid, there's $800 million waiting for us in federal taxes that we're not taking back because we haven't chosen to expand Medicaid. So if we do this, then we're going to be getting back $800 million into our economy, which is going to ripple through. And Utah Health Policy Project found that that's going to create about $1.3 billion each year of revenue to our state.
Rich people and politicians especially, they don't understand how health insurance can be important for poor people because when you are poor and you are stressed, so you don't have peace of mind, then you continue being poor. And when you have that peace of mind, when I don't have to think about my health, then I will think about how to improve my income. Politicians, they forgot that we vote for them. Okay, we vote for them.